Hi, this is Dr. Jason Skolar, chiropractor, producing another segment on a very important condition that affects millions of people worldwide. And this condition is called temporomandibular joint dysfunction, or TMJ dysfunction. This is a condition that can affect either one or both of the joints. It's a very complex joint called a gangliomo-arthrodial joint. And this joint, the function of this joint has two primary functions. When the jaw opens, there is rotation in the joint and actual translation and movement that allows the jaw to open. This joint ultimately is formed between the mandible, the lower part of the jaw, and the skull. And in between this joint, there's some tissue called retrodiscal tissue. And this tissue slides back and forth with normal opening and closing of the joint. And like any other joint in the body, degeneration can set in and arthritic changes can set in, which will produce a great deal of dysfunction and pain when a person tries to open or close their mouth. There are many causes for this type of problem, and a very common one is grinding one's teeth, especially when sleeping. And this condition is called bruxism. Also, opening the jaw too wide can also injure this joint. Certain traumas to the mouth or to the head can also produce problems related to the temporomandibular joint. So I'm going to perform a demonstration of active release techniques and how we use this incredible technique to treat this condition. So we first treat the muscles on the outside of the jaw manually. So open please, and close. So I'm working a muscle here called the masseter muscle. And this muscle, basically when it contracts, it closes the jaw. So open and close. Open and close. So I'm going to work this muscle from the angle of the mandible or the base of the jaw all the way up to where it attaches. Open. And this is going to release any adhesions in the actual muscle to facilitate opening and closing of the jaw. But remember, this muscle, when it contracts, it closes the jaw. Open. So I will work on both sides simultaneously or on the problematic side. Open and close. I can also work muscles higher up, a little bit more superiorly located, which we call the temporalis muscle, which also has fibers that insert into the joint. So we can work this again by opening and closing the jaw, especially during the opening phase. The adjustment is very, very useful and powerful because we can actually adjust this joint very, very gently with the hand, and we apply a little bit of pressure to actually stimulate movement of the joint and to break through any adhesions that may be present due to a TMJ dysfunction. So open the jaw, please. So the jaw will open, and I will come in and lightly adjust the joint. And I always adjust both sides. Open. And we can adjust both sides. I want you to bring your jaw forward. Open your mouth and push your jaw forward. Good. So we can work muscles on the undersurface of the mandible to really facilitate proper biomechanical functioning of the joint. The muscles that stabilize the joint internally on a deeper level are called the pterygoid muscles. And these muscles can be worked intraorally. And I will demonstrate that right now. So to work these muscles, this is more uncomfortable and a little bit more painful. So we always have to approach these muscles with great sensitivity. So open. So we go in and we locate these muscles by pushing on the roof of the mouth, just lateral to the wisdom teeth, and open and close. Open and close. Open and close. And one more time. Open and close. Open. We can adjust the jaw differently now. A little bit of traction and a little bit of lateral movement to adjust the jaw to ensure even more motion and less dysfunction. Open your jaw again and close. And open and close. So almost immediately after treatment, we see an improvement and an increase in the range of motion. It's a very, very powerful procedure that I use every day at my clinic. For more information, please contact me at 514-707-2222 and visit drskolarchiro.com. Thanks and have a great day.